In Nairobi, Kenya, nearly 10% of adults, more than 320,000 people in total, are living with HIV. A recent research conducted by the government puts HIV prevalence nationally at about 6%. At the coastal region, the prevalence is at 8.8%. Like Nairobi, it is nearly 20% higher among women. The AFIA Plus, AIDS Population and Health Integrated Assistance Plus Nairobi Coast Program, is a 5-year health services delivery program funded by USAID and working closely in partnership with the Ministry of Health Kenya and implemented through a partnership between Pathfinder International, Child Fund International, Cooperative League of the USA, Population Services International, and the Network of AIDS Researchers of Eastern and Southern Africa.
AFIA Plus Nairobi Coast Project provided HIV counseling and testing to over 2 million clients in both Nairobi and coast regions. Of this, 90,000 tested positive and were linked to care and treatment in the various facilities where we support HIV care and treatment services. When we link these patients to care and treatment services in the facilities that we support, we ensured that they are retained to services.
Although the majority of men say they are willing to know their HIV status, only 28% have ever actually been tested.
During my first test, I found that I was positive, so it was a shock to me, since I did not realize I had no pain in the body. There was nothing to detect that I'm positive.
AFIA Plus Nairobi Coast has been providing these counties with the resources necessary to change the prevailing behaviors and disease burden through implementation of behavior change education, awareness on reproductive health and sexually transmitted diseases like HIV/AIDS, among others. These they do in working closely with partners and the communities.
Over the last 4 years, we have been able to build capacity of our healthcare workers in different aspects. When we look at issues of HIV, for example, we are looking at the entry point, which is HIV counseling and testing. So the healthcare workers have been trained on the revised guidelines or the revised protocols for HIV counseling and testing, using the new test kits, rapid test kits. Issues of quality assurance within the HIV counseling and testing, and then after they have identified those that are infected need to be started on HIV care and treatment. So again, they have to be built their skills to be able to start patients timely on treatment and to be able to monitor them.
In the past 5 years, the consortium working under AFIA Plus Nairobi Coast has increased the capacity of health workers to provide quality health services, while at the same time strengthening the government's community outreach strategy. Such efforts have seen quality healthcare achieved and results scaled upwards, and at times surpassing the targets. In the area of prevention of mother-to-child transmission of HIV, AFIA Plus Nairobi Coast is working with the Ministry of Health at the numerous health facilities to achieve the government's target of total elimination of mother-to-child transmission of HIV, EMTCT.
First time nilikuja hapa Mbagathi, nilikuwa na mimba, kunitest, nikapatikana niko reactive. Wakaniambia kama nimekubali result zangu, nikawaambia nimekubali. Wakaniambia okay, sasa itabidi uanze kutumia madawa ili ukinge mtoto wako. Siku ya kujifungua nikakuja hapa Mbagathi, nikajifungulia hapa. Mtoto akapimwa, akapatikana ako negative.
We've been collaborating with AFIA Plus to provide the PMTCT services, and it has been very good. Generally, we have 100% success in PMTCT in MCHFP.
Nilipopimwa nilipatikana na virusi. Sasa walinifundisha, wakanambia jinsi niko supposed kufanya ndio siku ambayo nitakuja kujifungua mtoto awe niko sawa, nisiaffect mtoto wangu.
Na vile nilijikubali nikaendelea kuishi mpaka sasa hivi, naendelea kuelimisha mama wenzangu kwamba wanaweza ishi bila kutatizika na shida yoyote, wakiendelea na dawa zao vizuri. Ni muhimu sana kwa mama mjamzito kujua hali yake, sababu wakati hajapima hataweza kujua kwamba ameathirika ama hajaathirika. Na akija mapema kliniki atapima, atajua hali yake na itakuwa ni rahisi kwake. Kama ameathirika ataanza dawa zake mapema na ataendelea kuwa na afya zake siku zote kama anaishi na virusi.
With the mental mother having gone through PMTCT, with the fact that they are living with HIV themselves, they actually do very good support for these mothers, and we find these mothers actually getting now to disclose even easier compared to the earlier days when we didn't have mental mothers.
The mental mothers were very critical to our PMTCT program. As we began to wind the project, the county government began to ask what's going to happen with the county mothers. Through discussions, through advocacy, they were able to see the value addition of the mental mothers to the county, and the county was able to pick the mental mothers and put them on their payroll.
Mental mothers walibadilisha maisha yangu kwa sababu nilikuwa nimekata tamaa, lakini walinigeuza maisha yangu kwa supporting groups. Nilikuwa naenda napatana na wenzangu kwa hiyo group, najua siko peke yangu, kumbe kuna wengine wanono zaidi, kumbe kuna wengine ni warembo hata wezi dhani wako hivyo, kumbe wako hivyo. Hasa hiyo ilinipa moyo. Nikapata changamoto pia kwa sababu kiwa mtu wao uko positive mwenzako uko negative, hizo changamoto nyumba kama hizo zina changamoto, lakini nilipata wengine pale mpaka mabwana zao wanakuja pale. Nilisikia raha sana mpaka bwanangu naye akajoin nao nikaenda pale. Kwa hivyo ninawashukuru sana mental mothers. Nyumba yangu haikuvunjika, hao ndio waliunganisha nyumba yangu mpaka saa hizi tunaishi pamoja.
As of 2012, Afya Plus Nairobi Coast Project had established 167 community units, each of which includes 50 community health workers who support 1,000 households with essential services and information, among them HIV counseling and testing, HTC.
Tumekuwa na ile elimu ya encourage mwanzo disclosure, unaona amesha disclose information kwa partner yake, halafu kuna ile utumiaji wa condoms. Watu wanaanza kujua kwamba okay, nikitumia condom nitamkinga mwenzangu kutopata virusi. Unaona still pia tunaweza tumia condom kufanya kama family planning.
Afya Plus Nairobi Coast is also supporting lab networks with CD4 to enable effective ART treatments for HIV/AIDS, TB and other diseases. This is done in well-established campsites where other services like family planning, FP and cervical cancer screening are also done.
This is a referral site for CD4. That is, other centers bring their CD4 for analysis here, and this is facilitated by Afya Plus. The Afya Plus does the coordination of the transport arrangement to ensure that I get the samples on site. So that rider is always there 2 days in a week to deliver all the samples from those 8 centers to this facility. Since this linkage with Afya Plus Nairobi Coast, I can say everything has been smooth because we get our samples within the expected turnaround time. Something like this machine we use, it was them who facilitated for this site to have this machine.
As part of task shifting and enhancement of compliance to treatment and care, the project offers psychosocial support groups, peer groups and mother-to-mother for people living with HIV/AIDS to help with emotional support through counseling and adherence to medication help, inpatient referral, tracking and tracing medicine defaulters.
Mimi miaka ile iliyopita nilikuwa chini sana. Na tangu hizo programs zimekuja zikaniinua kabisa. Ikanipatia skills, ikanipatia knowledge, kutoka hapo nikaelewa na mimi kusaidia wenzangu. Ulipokuwa unapata mtu unakuwa peke yako. Unakuwa in isolation, unaona kama unaweza kuna discrimination, kuna stigma. But saa ile tunakuambia kuja support group. Ukiingia unapata wenzako. Then unasema kumbe I'm not alone, tuko wengi. Tuko wengi. Then ukitoka hapo umetoka na neno amba hata umekuwa healed because umesikia wenzako wameongea na wako na virusi kama wewe, then unapata umeinuka. Na hiyo sana ndio ilikuwa lengo la kutengeneza hii support.
To enhance efficiency, ICT has been part of the main healthcare service provision under Afya Plus project. Such has been used in defaulter tracing and also served to remind clients of their days of visiting health facilities for crucial services and uptake of medicines. The messages sent through the various short mobile messages have also been important in behavior change and has significantly reduced transmission of HIV.
Mimi nilianza kupata matibabu ya madawa hospitali mwaka 2005, lakini kufikia mwaka uliopita tukaanza kupata hizi huduma za SMS. Na hii huduma ya SMS mimi imenisaidia kwa sababu inanirahisishia kujua kuwa siku yangu imefika ya kwenda kwa matibabu, na pia inanipatia kujua kuwa nisikosee matibabu. Alafu pale ile huduma ambayo napata pale, naweza kupimwa uzani wangu wa kilo, na kando na kilo napimwa pia urefu wangu. Kama nimepunguza, daktari ataenda nishauri nisirudi kupunguza, nikule vizuri, niendelee kwa naweza kumudu urefu wangu na kilo zangu ziteremke. Zikiteremka kwangu ni vibaya. Kisha kutoka kwa daktari na nikisha maliza kliniki kwa daktari, naenda kwa pharmacy. Nikifika kwa pharmacy nakuta dawa zimetayarishwa, napewa, na nikishapewa basi naambiwa nitumie dawa vizuri mpaka wakati utakapofika ndo nirudi.
Initially when this clinic started, we used to see maybe a client for the first time. Then you give them maybe an appointment date, maybe they come after a month. Some of them would not come back. Some of them we didn't even know where they had gone. We didn't know whether they died or something. When that problem we saw like it was serious, patients were not coming back, we had to liaise with Afya Plus, who later helped us through this platform, this software. So it was easy for us. We used to communicate to the clients. At least maybe the client has no mobile phone, but they can give you for a little later, and it was easier maybe to try get in touch with the client whenever you needed them, unlike before.
Male-only clinics have also been created to promote increased male involvement in HIV and maternal and child health MCH services, particularly to support facility deliveries and uptake of PMTCT services. The project has supported communities to ensure that the increased availability of services address geographical, socio-cultural, economic, legal, regulatory barriers that impede access to care, with special reference to the poor and hard-to-reach populations who include the urban slums, remote rural areas, and pastoralist groups. In rural Mpeketoni, Lamu County, residents had to walk 20 to 50 kilometers to Mpeketoni Sub-County Hospital to access antiretroviral therapy. This resulted in people not taking their medicine or sharing medicine, which spurs drug resistance and opportunistic infections which can lead to death. Now, with US aid-supported antiretroviral therapy outreach, rural residents of Mpeketoni have access to health screenings and treatment, antiretroviral therapy and counseling and testing.
Nilikuwa ninashare madawa na wenzangu kwa sababu imeandikwa tu ni ARV na sikuweza kufika mahala pale pa kuchukua dawa kwa umbali. Nilikuwa nikichukua siku 3 kuenda pale kwa kuchukua dawa. Siku ya kwanza nitalala mahali ambapo sikuwa ninatarajia, ama sio pale pangu pa kawaida ambapo huwa ninalala, ili niweze kuamkia tena nifike hospitali. Nikifika hospitali nitatibiwa pale kitu saa 6 na sikuwa nimebeba chochote cha kuweza kuweka kwa tumbo, na unakuta nikirudi nyumbani nakuta mwenzangu tayari naye amekuja ameniomba ile dawa ambayo nimefika pale. Ninaweza kumkatia ama niweze kumpatia tu kama za siku 5, naye akienda aweze kuja kuniletea.
Mahali hapa ilikuwa sisi kupata ARVs ilikuwa ni shida kubwa sana ambayo ilikuwa inatukaba sisi. Manake ilikuwa ni mtu atoke kutoka hapa aende mpaka Mpeketoni ambapo ni urefu wa kitu kama kilomita 20. Magari ya usafiri pia yalikuwa na utata kwa sababu ilikuwa ni gari moja tu, na hiyo gari ikipita hauwezi kupata gari tena ndiposa uweze kwenda kuleta hizi madawa. Patient wetu walianza kushare zile drugs na tukaona ya kwamba hizi dawa zilikuwa zikiumiza watu kwa sababu zina make resistance saa nyingine kwa patients wetu, na saa nyingine tunapata hata vifo na tunapata side effect nyingi kupitia hizi madawa. Kufikia mahala pale ndio ofisi ya afya iliingilia mahali pale na ikabidi wakaanzisha outreach kuja mahali hapa Majembeni.
Gertrudes reached more than 17,000 young people with information about gender-based violence, reproductive health, and HIV and AIDS through peer education and school sessions.
But if you joke around with your medication, you will allow the HIV virus to replicate itself in your body.
I feel like I'm much more better than I came in terms of my health, because I'm getting the right medication and the patient service here is very good, and I'm interested in the activities. They seem like they would help me in future, and they encourage me to at least live my life on.
Afia Plus gave us a grant that we've been able to take care of our adolescents by holding support groups and having retreats. In the support groups, we get children, of course, who have already been disclosed about their status, where they come in and we share about, they share their challenges about living with HIV. They also share the fears they have about living with the HIV. They are able to be taken through adherence counseling, and also we have health talks that are adolescent related. We also have mini groups that they discuss their fears, their challenges, and everything that concerns them regarding their HIV status.
One of the key services that Afia Plus Nairobi Coast supported during the project period was HIV-TB integration. TB is one of the most prevalent opportunistic infection, in fact, the highest prevalent opportunistic infection amongst the HIV-positive patients. During these services, we ensured that all HIV-positive patients attending the HIV clinic were screened for TB during their routine visits. Afia Plus Nairobi Coast project was involved in the phase 1 of the national rollout of the voluntary medical male circumcision project. And we've supported by renovating infrastructure of minor theaters which would be used for circumcising men from non-circumcising communities. We also supported the capacity building of health workers. We supported in procurement of equipment and commodities to support these services.
In addition to the usual services, the epidemiology of the HIV and AIDS epidemic, Nairobi Coast requires attention to a large number of the most at-risk populations, including discordant couples, men who have sex with men, intravenous drug users, and commercial sex workers. Pathfinder through Afia Plus has awarded sub-grants to the approved local implementing partners, LIPs, to implement interventions targeting key affected populations, KAPs, workplaces, in and out of school youth, and to address gender issues. The results so far are exciting. Afia Plus Nairobi Coast worked closely to reach key populations with key services to reduce HIV/AIDS transmission among them and the larger populace. Several interventions were put in place to collaborate with them in order to achieve success.
Umuhimu mkubwa sana ni kuweza kutambua hali yako. Na kuna hatari ambazo huwa tunazifanya pindi tunavyotumia madawa kulevya. Hatari gani ambayo inaweza kutufanya sisi tuwe katika riski ya kuwa na HIV? Tumesema moja ni sindano.
Within the work we are doing with other partners, we have reached to almost 8,000 to 10,000 drug users within the Mombasa County and Kwale County, within the outreach program. And Afia Plus Nairobi Coast has contributed a bigger percentage. One of the achievements that we've gotten also in Afia Plus Nairobi Coast is the linkages of drop-in center like Reach Out with the health facilities, where we can be able to have the comprehensive care services from the government hospitals.
Lejua mambo mawili, mambo ya kushiriki sindano na mambo ya ngono pia vile vile, na kuaga kushiriki mambo yao sana unapata maradhi kama ya HIV. Sasa lazima ujichunge, unatumia mipira. Mambo mengine ni kwamba tusipende kushare sindano moja watu wawili ama watatu.
Niliwahi kutumia sindano ya mwenzangu ambaye alikuwa ameathirika, kuna virusi vya ukimwi na alikuwa na TB pia ambayo ni tuberculosis. But nashukuru yani hiyo TB mimi kunipata wakati huo, na pia sikujua kama tayari nishabeba virusi kupitia sindano yake yule mwenzangu.
Kusema kweli, reach out hawakuniacha nyuma kabisa. Walinisaidia vile wanavyoweza, wakanielimisha, wakanihamasisha ni jinsi gani nitaishi nikiwa katika hali kama hii ya virusi.
Through Afya Plus, we get connected with Mama Lucy and also training the healthcare providers. Like now here in Mama Lucy, we have very nice, lovely staff who make sure that they treat us in a very nice way, which is non-discriminatory. And I think it should also be copied to other organizations to have a genuine partnership and don't see someone as just a gay man or a sex worker, just how they view people. Through the sensitization, they view people as human beings, they don't see us as gay men.
Afya Plus Nairobi Coast actually made us to start off the services to the key populations, and we have been having offering services to them. For example, if they are going for lab test, they go and they are served faster, and then they go home. And knowingly, we didn't know that we are doing so well until they bring a trophy last year to us, and this year they have brought another trophy appreciating the services for Mama Lucy Kibaki Hospital.
Under this program, Pathfinder International believes that healthcare is not only a fundamental human right, but also critical in expanding opportunities for women, families, and communities, while paving the way for transformations in development.
When I got myself to Afya Plus, it's like I was green. I didn't know what I was doing. I had like 100 partners. I used to have sex without, I don't care. I used to care about money. But when Afya Plus came, they started teachers and telling us and sensitizing about how to use condom consistently without missing even once, because my health is my wealth.
They can trust us, yeah, with their issues. So most of them come and also refer their colleagues to this facility because of the confidentiality, privacy, and also the service that is offered. We've received supplies like gloves. What we do for cancer screening is done. We also received items from Afya Plus where we used to do cancer screening for the female sex workers, and also the injection diffusers, the IDUs, also the same thing through Afya Plus.
Afya Plus has initiated a variety of activities, including training of community health extension workers, CHEWs, and community health workers, CHWs, in technical service areas. These are people known by the communities and respected. And the successes were not only in the area of HIV. 5 years down the line, the project has increased access and utilization of high-quality integrated antiretroviral therapy against HIV and AIDS and TB, reproductive health and family planning, nutrition and malaria prevention, as well as management services in these regions.
The quality of the services that we provide was very central to this program. We ensured quality service delivery in many ways. One of the ways that we ensured service delivery was through support supervision. The support supervision was joint in the sense that we did not just have Afya Plus staff go out to the sites, but they were accompanied by government officials, especially who are related to those particular areas that we were providing services. And the purpose was really to ensure that the services that were being provided adhered to the national guidelines and the national standards and protocols that have been set by the government. The other way we ensured that quality services was provided is that the project designed a very unique monitoring tool that we called My Check. This is a tool that guided all the service providers who were under the project to be able to check and ensure that that particular service or that particular service element did adhere to the required standards. If you look at the infrastructure and the renovations that we've done for some of these facilities, you cannot take that away from them. It's something you've done. It's something that remains with those facilities. The equipment that were given, those equipments are being handed over to those particular facilities for them to be able to continue to use those services.
Kumala mala na kiyo kumala mala, kumala mala na kiyo kumala mala, doki kulola na kiyo doki kulola, doki kulola na kiyo doki kulola. Wako koko nao, oye mao. Wako koko nao, oye abaye. Wako koko nao, oye anguo. Wako koko nao, waneka bana waya na bambao, waneka bana waya na bambao. Kumala mala na kiyo kumala mala, kumala mala na kiyo kumala mala, doki kulola na kiyo doki kulola, doki kulola na kiyo doki kulola. Wako koko nao, wako